So hello everyone, my name is Dr. Hussain and I'm currently a prosthodontics resident at a college in Maharashtra. With me is one of my batchmates from my undergraduate college, Dr. Tirth Bhutada, who is also Vidarbha's first sports dentist. He has done his master's in sports dentistry from ISST?
Institute of Sports Science and Technology, Pune.
Yes, he has done his master's in sports dentistry and is one of the few sports dentists in India and the only one that I know. So, Tirth, I wanted to ask you, what exactly is sports dentistry?
So basically, sports dentistry is combination of all the branches which we study. It's combination of it starts from pediatric to its end to oral surgery. Sports dentistry basically involves all of the injuries and the management. So what I can say, sports dentistry is divided into two sections. First is management of the traumatic injuries which occur during on the field and the second is to help to prevent it by using proper mouth guards, proper techniques in that way. These are the two areas where a lot of things has been added in sports dentistry.
So before those injuries happen, you help educate the athletes, and also after they've occurred, you help also.
Yeah, we do in both ways. For example, in before the tournaments, what we do is we do a pre-screening camp where we get to know what all problems that our athlete is facing dental related. We try to treat them so that it should not occur, the pain or anything should not occur at the time of tournament.
Right.
Because as we all know, dental pain is very painful. And secondly, we also try to prevent it. So it is done by using a custom mouth guards. We highly believe in giving custom mouth guard rather than other mouth guards which are available in market which are not safe.
Basically, the contact sports you over like MMA, boxing.
Actually, the sports which you are speaking, these are the sports where it is compulsory. But I feel there are it's not about me. There are more than 25 sports where mouth guard is needed and mandatory.
Right.
And further, we have also worked on something which allows mouth guard to use in each and every sports where even we need to communicate.
Okay, before we get into the details, so Dr. Tirth, there are various academies in sports dentistry. For a student to get into sports dentistry, can you tell us a little bit about your journey? How did you get into it, and what academies there are? What is the duration of the course?
So I got introduced to sports dentistry by a small seminar which occurred in Mumbai, IDA head office. From where I got to know about that. It was a seminar basically which involved all the other sports industries like sports medicine, sports nutrition, sports psychology. So by that way I got to know that sports dentistry is very interconnected to all these fields. Right. By seeing that, actually the thing is I am very sports enthusiastic and dentistry with sports is something I will thrive for. Right. So that was the reason I selected this branch. And there are basically two places from where the sports dentistry courses are available right now in India. First is the IDA, from the IDA fellowship course, and second is from which I did, that is Institute of Sports Science and Technology, which provides master's program in sports dentistry.
That is in Pune?
Yeah, this is in Pune.
Okay. So can you tell us how long is that course, and do you have to be there full time, or how does it? Can you just tell a brief about it?
Fortunately, these both courses are hybrid. Okay. So basically, every person who is doing practice can take part in this course. The one in which I enrolled, it is a hybrid course. Like the theoretical, all the lectures we have to do online. And after that, there is a practical workshop, 3-day online workshop, and then a week of offline workshop.
Okay.
So there we get to know how to manage. There are some protocols which we need to follow: fabrication of mouth guard, what are the emergency situations we need to handle, how to handle. This comprises of it all.
So how long is that course?
Both courses are for 1 year.
For 1 year. And okay, what happens at the end of the course? Like, is there a practical exam also that you need to
do? In both of the cases, there is a practical exam. Firstly, the offline workshop occurs, and then we have to give a practical exam with that.
Okay. So let's say that you're a sports dentist, right? So after the completion of this course, what are the added benefits of it? Like, what more can you do apart from being I don't like the word, but a general dentist? What apart can you do from that in the field of sports? Like, what value are you adding in that field?
First of all, I would like to say general dentistry is very different, sports dentistry is very different, and I believe I am more focused on sports dentistry part. So my future plans are also related to sports dentistry itself. So that's the thing. Sorry, what was the question?
The question was what applications are of sports dentist? What are you providing, like mouth guards?
Yeah, so there are ample number of things which a sports dentist can provide. First of all, the most what we can say is mouth guards, and especially custom mouth guards. So that is the field, and we have done a lot of research on that, and we are still doing it. Custom mouth guards are what I feel is very a topic which not all of dentists know, and how to fabricate it, what all things are used,
the
materials, because getting the material is the most difficult part, because when I started to the thing is the mouth guard sheets which are available in India, they are only of transparent in nature, which are available, and that too they are a bit expensive on the side. And the mouth guard has a craze, like in other countries, mouth guard is used as in protection as well as for fashion or a trend. So the customization part needs some mouth guard sheets which are not in transparent, which are not available in India. In fact, I imported it from US. So that is one of the major problem which I am facing right now in India. Let's hope that things get.
I'll add a photo of one of the mouth guards that Dr. Tirth has fabricated. It'll be somewhere here. So that's it. Okay, so we're done with the applications. We're done with what exactly is sports dentistry. Now, what is the current scenario of sports dentistry in India? Like you just said, like I'm a BDS graduate now that I've done sports dentistry. Now I cannot expect like offers will come from me from various academies, and I will not flourish immediately. You said this is a nascent field, this nascent specialty. Can you tell us more about it?
Yeah, exactly. The thing is, there is a lack of awareness is the major problem, and what we are doing as a sports dentist is creating awareness, which I feel in next 2 to 4 years, I feel sports dentistry will be a very established branch, and as we are hosting Commonwealth in 2030, that will give a lot of boost, and the main thing is there is lack of awareness. You won't believe the lot of dentists even don't know what sports dentistry is and what it includes. When I started to introduce to some dentists to take opinion should I do it or not, that those dentists were blank. So that is a major problem which I think is there is a lack of awareness in it.
So Dr. Tirth, you mentioned that you had enrolled in the sports dentistry course and eventually you became a sports dentist, right? So let's say I want to become a sports dentist, and I'll just go on Google to these academies that you have mentioned, and they will have all the details about it, right?
Yeah, it's been clearly mentioned in their website about how to enroll, what all things are there, and how you can enroll, what are the eligibilities. Everything is mentioned on both websites.
And conferences also occur for these courses?
Right now, recently one conference did occur in Pune. It was held by the same organization from which I did. Small sports dentistry symposiums occurs regularly, which are held by IDA. But not in India, but in other countries, the sports dentistry conference are held on a very grand level, and that too at a very good pace. So we still need. I still think that India needs to focus more on it, and hopefully in next 5 years, I feel there will be a lot of conferences with a grand gesture from that.
Right. So we know that India is great at cricket. India also plays a variety of sports like hockey and all, even though cricket is the main focus usually. So does the Indian cricket team have a sports dentist?
No, currently not right now. I feel it will occur, but the thing is, cricket is a kind of sports where already lots of guards are already being used. For example, a cricket, he wear from head to chest to abdomen. Everything is been protected, and helmet mostly protects it all. But what I feel, the mouth guards should be used during fielding by bowlers, even for umpires, because they are most prone to injuries, as well as bowlers and fielders. And I feel bowlers and umpires should regularly wear it, because you can never guess when ball will come and hit your face.
Right, that is. So Dr. Tirth, you mentioned that sports dentistry is an amalgamation of all the branches, like it has application in all the branches. Can you explain us about it?
Yeah, so basically it starts from pediatric dentistry. Even MUHS has granted the fellowship in pediatric department itself, because a lot of injury occur in sports during the kids level. Injuries do occur in adult, but the most prone injuries are kids. So that is the thing. So it involves basically in pediatric patients, it involves normal extractions if the tooth are mobile and deciduous,
after the injury.
After the injury, or the root canal treatments in order so that the next tooth can grow. We cannot do lot in that, but that needs to be assisted. And mouth guard is compulsory. I feel mouth guard should be used. There's a lot of things that deciduous teeth, why deciduous teeth need mouth guards. So for that, what I can recommend is they can use boil and bite mouth guards, which can be manipulated again and again till the complete permanent denture erupts. Then this was pediatric part. Then it comes to ortho. For example, class 3, class 2, as you know, in malalignment, when there are high chances. If person falls, the class 3 person will get injured. So ortho correct. For example, athlete comes. I am seeing that he is a class 3 person. So a class 3 case. So what I will recommend is to go directly for ortho treatment as early as possible, so that during the when you are peak at that sports, your this anomaly should not play a major role. So that can injure you very badly.
Right. And prosthodontics trauma.
Prosthodontics trauma and rehabilitation treatment. What I feel is it's very important for athlete what treatment plan we are using for him. For example, I can give you like a person who is playing a contact sport at very high level. What I recommend is if the tooth are broken, anterior tooth are broken, we cannot recommend him implants, because the continuous impaction on that area, there are high chances of implant getting failure. So we have to select the treatment accordingly. So in that, prosthodontics play very important role, like which kind of treatment plan we need to plan for them. This is the thing. Then
but for him the priority would not be aesthetics or repairing that.
Aesthetics are priority. Aesthetics is priority for everyone, but we need to see what kind of sports he is playing and how will that help. That treatment will help him, or it will create a problem.
Exactly. What I mean by that, let's say he got his teeth broken down, and replacing that teeth won't play a major role in that moment. If he has a match like tomorrow or day after, I wouldn't recommend a treatment that is too taxing on his body or other thing. That will have to be delayed, and your role comes into play.
Yeah, for sure. That you are at this point you are completely correct.
Then we can have a collaborative discussion about it.
Then endo plays very important role. Mostly in avulsion cases and knocked out tooth, we need to do endo treatment first. Then we need to place it, or we need lot of endo treatment like class 1, class 2, class 3 Alice fracture are very common in these sports. Then next is oral surgery. All the contact sports which I have mentioned previously, there are high chances of getting facial injuries. Mostly what I have experienced from my in the tournaments which I was here as a sports dentist, in contact sports, specifically MMA, boxing, there are lots of oral injuries which include lip lacerations, soft tissue injuries, and hard tissue, as well as teeth fractures, avulsions as well as lots of facial cuts as well. So oral surgeons play a very major role. So in this way, a sports dentist need to get all the gist of all the branches together in order to provide best treatment to athlete.
Right. So that brings me to a question here. Okay, let's say a person has done sports dentistry. Now I don't believe he would be immediately able to go into tournaments and help people. How will he gain that experience initially? Because you said it is a nascent field, right?
Yeah.
Of course, he'll be a specialist in that, but still he'll not be able to directly go and be the pro that people want him to be, no?
Yeah, that I can agree. Right now, that is a problem. So for that, what we as a sports internal organization do is we need to create awareness. In order to create awareness, what we do is we do a small sessions which gives how to manage the treatments if the sports dentist is not there. In that way, they get to know the importance of it, and by that way, we get. It's not like other people are going to approach us. We need to show that this branch is now available in India, and we need to like, for example, what I did is I approached various academies that I am the sports dentist and this is what I do, and I create awareness about it. So in that, then after people knowing that, people getting aware that how important this branch is, they started to give me a call. They asked for my consultations. So it's not like they are going to approach. We need to go and first approach them, because lots of people don't know. As I said, lots of dentists don't know about this branch, so we cannot expect that normal people will know about it.
Even like in dentistry, people don't know, like even in dentistry there are specialities. So
yes,
for sports dentistry, people will have to like work a lot at too. So I believe that's it. That brings us to the end of the video. In the last section that we did discuss, I think, I don't know if you'd agree, but a small suggestion came, like people in sports dentistry who have recently been graduated or who will be graduating should do a lot of volunteering work as well. Initially,
yeah, for sure.
To generate their experience also and awareness as well.
Yes, that is the main key right now. I think for next 2-3 years we need to do that lot in order to create awareness. And the organizations are the organizations which are there in India. They are also working heavily on that. So slowly they are collaborating with others like Sports Authority India, other some sports organizations as well, like MMA federations, Rugby India. So slowly the awareness is getting created, and the sports authorities are able to know that how this branch works. And they are hiring people as well in sports dentistry.
So eventually, hopefully, the government can take notice, and eventually there will be norms of academies and let's say teams that you need to have a sports dentist mandatory.
Hopefully, in next 5 to 10 years, that will be a compulsory for every sports. Is what I have got to know, and I hope that will occur.
So let's say a potential sports dentist, future dentist is watching this video. So I want you to tell him about. I want to just ask you, what kind of a person should get into sports dentistry, and if there are any potential candidates who want to get into this field, what advice do you have for them in brief?
So first of all, as lot of people know, dentistry is very vast, and out of this sports dentistry is very different from normal dentistry is what I can say. So the first most important thing is, in order to make career in sports dentistry, they need to have enthusiasm for sports. They need to have that interest. If they are just seeing that this branch is there, I just want to approach it. It's not like that. You have to be interested in that, because it demands a lot. And the fruits, getting the fruits need time. It's not like I have become, for example, myself also, I have become a sports dentist. I will not get everything what I want, every success what I want at very start.
Correct.
I still believe I have got only 10 to 20% of what I can more achieve right now. So that is the thing. A lot of things. What I believe is sports dentistry required a lot of patience. It's not like every other branch. For example, 30 years back, I don't feel aesthetic dentistry was that important. But now people thrive to learn aesthetic dentistry. This is what I feel sports dentistry will further become. Not in terms of money maker also, but that will be a need of that time. Because India is growing in sports vastly. So that will need. And future we are planning to host Olympics as well. So for that we need to be ready by infrastructure wise, by medical facilities wise, as well as dental facilities wise.
Correct. So there you have it, folks. Thank you, Dr. Tirth, for explaining us all about sports dentistry. If you have any queries about sports dentistry or anything else, I will leave Dr. Tirth's email ID down below and you can mail him about it. And thanks for watching.